A low blood pressure is when systolic blood pressure is less than 90, the upper measurement, and diastolic pressure is less than 60 millimeters of mercury, the lower measurement. The most common symptom of low blood pressure is dizziness, when a person feels like the room is spinning. The second most common sign is lightheadedness. The person may say, I feel light, I might pass out any second. The third sign is syncope, when the person suddenly blacks out and wakes up on the floor. And fatigue and weakness are also common. Sometimes blurred vision, nausea, and cold and clammy skin are noted. Palpitations can also occur. The most common cause of low blood pressure is genetic or constitutional. It means that people are usually healthy, often slim, and they feel fine. They have no symptoms, but they have low blood pressure. Such cases make up around 50% of cases, and it's common in young adults. Typical low blood pressure here is around 90/60, and sometimes even lower, like 85/55. But they usually have no symptoms. Moreover, people with constitutional hypotension, if they have no symptoms, actually have lower lifetime risk of cardiovascular disease. And many cases, they live longer compared to general population. The second most common cause is medications, like drugs for high blood pressure, antidepressants, antipsychotics, and diuretics. They can cause hypotension. Such cases are especially common among women. The third most common cause is dehydration. It happens when you are not drinking enough water or from excessive. It's very common and can happen to anyone, especially in hot weather or during illness. Another cause of low blood pressure is hypothyroidism. The person feels fatigue, weakness, weight gain, and has cold intolerance, always feel cold. Dry skin, dry hair, slow heart rate, and constipation are also common. Also, bed rest and physical inactivity can cause hypotension. When someone stays in the bed for several days or weeks, especially after surgery or illness, blood vessels and nerves become less responsive to postural changes. Blood pools in the legs, and when standing, the body can't compensate it quickly. This causes a sudden drop of blood pressure. That's why people feel dizzy, lightheaded, and may faint when trying to stand up or walk after long inactivity. This condition is more common after 60, but can happen at any age. A very common but benign cause is vasovagal syncope. It is one of the most common type of fainting. It happens when the heart rate and blood pressure suddenly drops. It occurs when the vagus nerve overreacts to stress, pain, or standing too long, fear, even seeing blood. This condition affects around 20 to 35% of people at least once in their lifetime. It most commonly occurs in young adults and teenagers, especially females. Triggers can be emotional stress, seeing blood, heat exposure, standing too long, pain, or fear. It usually happens suddenly, often feeling anxious or nervous. When hypotension occurs after 60, the most common cause is medications like diuretics, beta blockers, AC inhibitors, alpha blockers, and antidepressants. The second most common cause is orthostatic hypotension. When a person feels dizzy or faints upon standing up, it affects around 20 to 30% of the population. When blood pressure drops by around 20 millimeters of mercury in systolic pressure within 3 minutes of standing, it is called orthostatic hypotension. It works after meal and in the morning. It's common in people with diabetes, Parkinson's disease, and those who are in physically deconditioned. Heart failure is another cause of hypotension, responsible around 10% of chronic hypotension cases in elderly. These people usually have fatigue, shortness of breath, swelling in the legs, rapid and irregular heartbeat. Despite fluid retention and edema, they often have low blood pressure, and symptoms get worse with exertion. They often have a history of heart attack, arrhythmias, or known heart failure. Sometimes autonomic dysfunctions like Parkinson's disease or diabetic neuropathy cause hypotension because blood pressure regulation fails. They may be associated with loss of sweating, constipation, or urinary incontinence, more common in people with long-standing diabetes or Parkinson's disease. Now let's say how to treat hypotension. For orthostatic hypotension, when blood pressure drops after standing up, the first step is to stand up slowly. Avoid sudden postural changes and elevate the head of the bed by around 10 to 30 degrees during sleep. Compression stockings help reduce blood pooling. Slightly increased salt intake may be recommended unless there are any heart or kidney problems. Drink more fluids, around 2.5 liters per day, eat small, frequent meals. If symptoms persist, medications like fludrocortisone or midodrine can be used, but usually medications are not required. If there is vasovagal reaction or vagal overreactivity, the treatment is recognizing warning signs like nausea, warmth, or tunnel vision. Do physical counter pressure maneuvers, cross legs and tense the leg muscles, or clench fists, or squeeze arms. Hydration and salt intake may help. Blockers can be used, but they are not part of common treatment. For prolonged immobilization, when hypotension occurs after bed rest or long inactivity, the key is early mobilization, ideally within 24 hours or 48 hours after surgery or illness. Physical therapy and walking is very important, help restore vascular tone, and passive leg movements or compression devices during bed rest also help. Standing up slowly, elevating the head of the bed, and staying hydrated are crucial always. This type of hypotension usually resolves within several days or several weeks, especially in young people. The cause is dehydration, treatment is fluid intake. If the hypotension is caused by medications, adjusting the dosage or stopping medication, if possible, is a solution. In hypothyroidism, the treatment is hormone replacement. In heart failure, the goal of treatment is to manage heart failure.